Welcome to Autumn Approved, a channel where we review all things that make parenting easier and to see if my daughter Autumn approves. On this episode, we're going to do what's in my sister's hospital bag. Because she was high risk with gestational diabetes and high blood pressure, we wanted to share what she was going to bring to the hospital. My first recommendation to her was to bring a rolling luggage bag so that she didn't have a hard time bringing it to the hospital room. The first thing is a nursing pillow, since pillows in the hospital are a hot commodity. Next is her toiletry bag. She has moisturizer, some travel size shampoo and conditioner, washcloth, a hairbrush, things that the hospital may not have, deodorant, scrunchies, chapstick, toothbrush, Q-tips, you name it. She also packed floss picks and a sleep mask. And because she is gestational diabetes, she has to check her blood sugar often, and she brought her own Lancets, which is in this pouch. The hospital does have Lancets, but they allow you to use yours if it is a smaller prick. She's also packing some slippers as well as shower slippers just in case. The next packing cube is all of her clothes. In the hospital, she will be dressed in a hospital gown, but I recommended her to bring some loose, fitted clothing for going home, as well as some comfy nursing pajamas and nursing and pumping bras so that she can be comfortable while she nurses the new baby, as well as has a bra to hold up the pump parts while she's pumping in between. She also packed a nice little robe that she can wear over her pajamas and nursing wear so that she can walk around too. Did I mention packing cubes are very helpful in keeping yourself organized and keeping your luggage nice and neat? These packing cubes are from TJ Maxx, I believe. This next packing cube is going to be all of the baby stuff. So that first item that she held up was a swaddle. She's also bringing a little newborn hat as well as some socks and gloves. That little kit that she held up was to do footprints. And she's bringing different size onesies because GD moms usually have bigger babies while hypertensive moms have smaller babies. So it's always good to be prepared with different size newborn clothes. She's got a couple of newborn size as well as preemie size baby clothes. This next section is all tech stuff. First is her Nintendo Switch as well as the charger, something to keep her occupied during labor. And more importantly, all of your chargers for your phone, especially if that's what you're going to use to capture video and photos. My sister here is bringing wall chargers and a portable charger just in case. The important thing to remember is to make sure you have cords that are long enough to reach the outlets. In addition to the chargers, my sister is bringing an iPod, which is already loaded with her playlist, as well as a Bluetooth speaker and a tripod. Lastly, a folder to keep all the important documents. And finally, some snacks. She's going to bring her water bottle, and most of these snacks are carb conscious because she is gestational diabetes. She still has to watch her blood sugar levels, and these snacks will make sure that it doesn't spike those levels. Even after giving birth, when you are high risk and have gestational diabetes, they do still check and monitor your blood sugar levels. So having snacks that you can eat while you're in your hospital stay is very important. The hospital doesn't always have a variety of carb-conscious snacks for patients, so bringing your own ensures that you at least enjoy the snacks. After getting everything in packing cubes, this is why I recommended the rolling luggage, because you can put everything inside and organize it neatly. And if cabinet space is limited in the hospital, then at least this can stand on its own and you can roll it out of the way when needed. Also, when you're going to and from the hospital, you have a luggage that you can just roll versus carrying it on a messenger strap. There are a lot of people that really pack minimally for the hospital, and that's fine, but because my sister is high risk, she doesn't really know how long she'll be staying or if there will be any complications. God willing, there was none when she was there, but it's better to be prepared with everything that you need, especially if you don't live very close to the hospital. So that's everything that we packed for my sister's hospital bag. Her husband's hospital bag has different items because, of course, the men don't need as much as the women do when it comes to labor. But I hope that this was helpful for any of you moms out there that do have the high-risk pregnancies, hypertension, gestational diabetes. Know that you are not alone and it's okay to bring a lot of stuff. And I wish you all a wonderful labor experience. Till next time.